for being a part of this training today. I am super excited. I was telling Lindsay earlier that I had a hard time sleeping last night, falling asleep, because I'm just so excited to be with my Wyoming friends. Y'all are near and dear to my heart, and even though I'm not in Wyoming anymore, I just love it and I miss it. So I chose the backdrop of the bighorns for this presentation today. As Lindsay said, I am the project director for the Safer Homes Collaborative at the Missouri Institute for Mental Health. We're located at the University of Missouri in St. Louis. I've been with this project just about 2 years under grant funding, or no, just over 2 years, I'm sorry, under grant funding. And we have one more year in our project with our current funding source, and then we're going to be looking for additional funding. So I want to thank all of you for this opportunity to share with you conversations on access to lethal means. I'm especially excited because I know many of you who are here a part of this workshop today from my time living in Wyoming and being a part of the Suicide Prevention Coalition. Many of you may know my personal story and my history of being a suicide attempt survivor, and then working pretty passionately in the with the Suicide Prevention Coalition in Campbell County. So it is just a treat for me to be to have had the opportunity to be with you all today. So thank you. I wanted to kind of acknowledge those who helped create this training, starting with Elaine Frank. She has become just a fantastic colleague of mine in working with this. She originally developed she originally developed this as counseling on access to lethal means with Dr. Mark Sioka at the Institute of Injury Prevention at Dartmouth. Back in 2006. And I first heard about the concept of lethal means reduction and temporarily removing firearms from the home as a way to prevent suicide back in, I can't remember if it's 2014 or 2015, when BJ Ayers brought Kathy Barber out from Harvard to a conference that she hosted in Cheyenne. Kathy Barber shared her research about lethal means reduction and the work that she and Elaine were continuing with the New Hampshire Gun Shop Project, the New Hampshire Firearm Safety Coalition. And when she presented this concept and their work and showed their videos, to be quite honest, I was a huge skeptic. In fact, Kathy and I kind of still laugh today because I believe I said to her at that time, not even knowing her, none of you that know me will find this as a surprise, but I said to Kathy that day, I said, you know what, I think this is gonna go over like a flaming turd, trying to convince Wyoming gun owners to give up their guns. But then I had the opportunity to learn more about the science behind lethal means reduction in my work as a suicide prevention specialist, and then through my work as the project director for the Safer Homes Collaborative, where we work really hard to bring together gun owners and gun retailers and the suicide prevention community to advance our work in this training opportunity. So I just want to give a special shout out to all of those who helped us at the Safer Homes Collaborative to develop this workshop. As I mentioned a little bit earlier, this training was adapted from Elaine's original work on counseling on access to lethal means. Counseling on access to lethal means was developed for behavioral health and medical providers in a clinical setting, to give them tools to counsel their clients and their patients about how to temporarily reduce access to all kinds of lethal means, but particularly firearms. With our adaptation, we wanted to be able to engage and empower gun owners and retailers so that they have a role in so that they know they have a role in preventing suicide. And I don't have to tell any of you in Wyoming about suicide or that it is a leading cause of death across the lifespan. But fortunately, there are evidence-based strategies that we can implement in our own homes, or we can recommend to our friends and family members or parents of our students or our clients to increase safety and to consider temporary offsite storage of a gun or other lethal means if someone in the home is going through a rough time and is feeling suicidal. So we're going to review some public health data regarding suicide and access to lethal means. This highlights the importance of removing access to lethal means. We're going to discuss what means are most lethal and describe how to have a culturally competent conversation regarding securing lethal means, specifically firearms. I'm trying to manage kind of a lot of boxes right now at the same time. So if you have any questions as we go along, feel free to type those in the chat box, and I will try to keep an eye on that so that, oh, there's a black box blocking slides. Oh, I know why. It's because I was trying to allow people to come into the room. How's that? Is that better? Yes, okay, good, great. I apologize for that. Sorry, I'm letting everyone into the room and trying to manage the chat box and do my presentation all at the same time. So I'm a little trying to be ambidextrous. Okay, let's move on. I'm gonna do my darndest to keep this in within an hour too, so. Okay, so let's start the conversation thinking in terms of home safety. You know, there are all kinds of things that we do in our homes to ensure safety for our loved ones. You know, when we have toddlers, we install safety gates, hopefully we do, at the top and bottom of stairs so that they don't fall down or climb up and get hurt. We install smoke alarms and carbon monoxide detectors to alert us to danger. We identify and practice with our kids how we're gonna get out of the house in case of a fire. We minimize trip hazards in our home and wipe up spills to make sure that, that our older loved ones who may not be as mobile don't slip and fall. We encourage the safe storage of household cleaners and toxic products. We keep those out of the reach of children, and we install the baby locks on our cabinets so that they can't get a hold of those. Many of us secure our TVs or our appliances or large dressers to the wall so that they can't be tipped or pulled over on little children. But there's one more one more safety tip that I want you to add to your thought processes when you think about about home safety and keeping your loved ones safe. And that is to consider temporarily storing off-site firearms or other lethal means when someone in the home is going through a rough time or maybe feeling suicidal. So, oops, sorry, my slide didn't advance. So why should we talk about gun suicide? Well, in Wyoming in 2018, suicide was the 7th leading cause of death for all age groups. It was also, quite sadly, the leading cause of death for young adolescents and young adults, ages 15 to 24. But a larger age span, it's the 2nd leading cause of death for people ages 10 to 34 years old. So young people in the prime of their life that have so much ahead of them, second only to unintentional accidents or injuries. I'm sorry if you can hear my puppy in the background. She's on the other side of the door and can't get to me and she's whining. Hopefully someone rescues her. As well, we want to talk about suicide because the rate has increased in Wyoming 34% since 2001. So it's on the rise, and I'm sure I don't need to tell any of you about the devastation and the tragedy of suicide. In Wyoming, 7 out of 10 suicide deaths are by firearm. Many of the youth suicides in your communities that are by firearm, that young person used a firearm that was owned by a family member. It's often that young person's parent. It might even be their own firearm. Talking about suicide is a research-informed prevention practice. We know that by talking about suicide, we can help others seek help. We can help them feel heard, and we can normalize some of their experiences, and we can get them on a better path towards health and wellness. We also believe that everyone has a role in preventing deaths of despair. You do not have to be a psychologist or a counselor, a doctor. You can be anyone to prevent suicide from happening in your home, at your workplace, and in your communities. Bottom line, suicide is generally preventable. We recognize that it's not always possible to prevent every suicide death, but by just enhancing some of our safety practices in regards to lethal means, we can prevent suicide. So a quick review of what leads to concerns for suicide. Sometimes it's people that are living with mental illness or a mental health condition. Oftentimes that mental health condition, the common denominator is depression. Maybe it's a major life change, facing a breakup or some other type of life crisis that they're experiencing. The use of drugs or alcohol can lower someone's inhibitions and can exacerbate those feelings, those messages of despair and despondency, and reinforce those feelings about suicide. A warning sign could be a loved one withdrawing from the normal activities that they would normally find pleasurable, talking about despair and feelings of being better off dead, or expressing that they've lost hope that things are gonna get better. Maybe they're acting recklessly, engaging in risky behaviors that could result in an injury or death. They may be expressing or acting as though they feel trapped. They feel trapped by their current circumstances. And then also having access to lethal means increases someone's risk for suicide, simply because in a moment of despair and urgency, if they can quickly access something that can bring about their death, there might be a little opportunity for intervention and prevent suicide. So kind of just reframing some of these warning signs is looking for a change from what is typical or what is expected behavior from that person that you know. Maybe it's a change in their mood. Maybe for a period of time, you know that they've been struggling, you know that they've been depressed, and they have had a sudden and an unexplainable uptick or upswing to feelings of euphoria. And maybe that can signal that they've shifted from ambivalence about living or dying to having made a decision. Maybe they're more depressed or acting out with irritability or anger. Maybe you know that they're experiencing a major life change. Maybe there's a huge, we're going through a global pandemic right now, and there's a lot of uncertainties. Jobs are affected, finances are affected. And so that's a time when uncertainty about how am I going to take care of those that I love can creep in. The use of substances, changes in behaviors, and then a change in their affect or their emotions from what you would normally see from them. So as I've mentioned maybe a couple times now that this was developed based on the clinical model of counseling on access to lethal means that was originally born out of the Injury Prevention Center at Dartmouth. It's also, counseling on access to lethal means is also a featured resource by the Suicide Prevention Resource Center. So if you want more of the clinical experience of this training and less of the general public that this presentation was created for, I encourage you to check out the Suicide Prevention Resource Center and take that 2-hour online counseling on access to lethal means workshop. It's free of charge. You can get a certificate when you complete it, and many credentialing boards will accept that as a higher level of suicide prevention training for licensure. Now, I want to make a couple of key points about this training. CALM is just one part of suicide prevention. It's not the answer, but it should always be part of the approach. It should always be a part of an answer. So whether you are, a mom at home or a parent at home, and you're concerned about your child or your spouse or your elderly parent, whether you are a clinician or a school counselor, you should be thinking about having this conversation with the person that is at risk for suicide, or the persons that have the decision-making powers within their home if they're a minor. So we want to be sure to include this into those conversations. The second point I want to make is that none of my comments are meant to be interpreted or heard as being anti-gun. CALM is not at all anti-gun. In fact, it was developed with gun owners in participation with suicide prevention and injury prevention experts. We are anti-suicide. Our goal is to prevent suicide from happening. Let's see here, sorry. So can CALM work? The answer is yes. With some effort, we can see success. And we have several examples of how reducing access to lethal means in other countries or in by other means for suicide can be quite effective. So let's take a look at a couple of those. So the first example is Sri Lanka. In 1995, the World Health Organization put some restrictions on the most toxic chemicals, or made recommendations to put restrictions on the most toxic chemicals that were found in pesticides. And in Sri Lanka, they were often stored easily accessible to people. They might not even been stored in an enclosed space. And so it was very easy for people in the villages to access an extremely toxic and extremely lethal chemical and bring about suicide. But when they placed restrictions on the sales of those most highly toxic chemicals, and they changed the storage practices, they started locking up those pesticides so that they couldn't be accessed, their suicide rates dropped by 50%. Now, other methods for suicide did not decrease. It was just from poisonings. It was just the rates for poisoning suicides that decreased. So some of you may be old enough to remember that carbon monoxide poisoning in the US was a common method for suicide. But back in 1975, with the introduction of the catalytic converter, because of EPA standards and not emitting toxic chemicals into our atmosphere, the catalytic converter changed what was emitted from the exhaust of the car and made it less toxic, made it less lethal. And so when they did that simple change that had nothing to do with suicide prevention, the suicide deaths dropped by this method. Didn't drop in other methods, but it did drop by carbon monoxide poisoning. And in Israel, young people ages 18 to 21 have compulsory participation in their military. And in 2003 to 2005, an average of 28 suicides occurred each year amongst members who served in the Israeli Defense Army. 26 of those 28 suicides were by firearm, and many of those suicides occurred on the weekends. And the common denominator in those suicides was easy access to extremely lethal means. And so the Israeli Defense Force asked the question, how do we stop our young people from taking their lives? What can we do to prevent this? And so they instituted a policy in which soldiers were required to leave their firearms on base when they went home on the weekends. When they did that, their suicide rates overall dropped, and it dropped by 40%. Weekend suicide rates dropped significantly. Weekday suicides didn't drop as significantly, but they did reduce a little bit because those young people were around or had access to other supports. And so simply by not allowing them to take their firearms home on the weekend, they were able to make an impact on preventing young people from killing themselves. So that brings us to CALM, conversations on access to lethal means, where we want to encourage folks to put some time and distance between a person in emotional crisis and access to any or all lethal means, but specifically the most lethal means in order to save a life. So I want to show you a video, just a quick video from our friends at the Utah Suicide Prevention Coalition that really speaks to this quite powerfully. I do want to warn you that you're going to hear 2 gunshots at the beginning of the video and then 2 more at the very end of the video. All right.
Last year I was at my lowest, going through some pretty serious depression. A couple of friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
All right, hopefully everyone was able to hear that. Okay. I'm trying to, I'm struggling here to get my PowerPoint opened back up again. Sorry, hang with me for 1 second. Okay, hopefully you all can see my slides. Okay, so excellent message from the Utah Suicide Prevention Coalition. So CALM may be helpful because of ambivalence. Most people who have suicidal thoughts are unsure about their desire to continue living or wanting to die. They're looking for a way to end the pain that they've struggled with for quite some time. Oftentimes, thoughts and feelings about suicide are transient and temporary. They aren't necessarily always a constant drumbeat. They can come and go. They may come under feelings of extreme duress. And they may be very quickly and easy to push aside and push out of the thought process. Thoughts about suicide can come on quick. And in order to end despair or feelings of pain, suicidal thoughts are often, the decision to suicide or to attempt suicide can be reached very quickly, especially among young people. And so if there is an immediate access to a firearm in the home or easy access to a firearm in the home or pills or other lethal methods, it's hard, the opportunity to intervene and rescue that person gets even harder. And then also CALM can be successful because different methods vary greatly in death. So even if someone had a plan for how they would attempt suicide, but they couldn't access that method, and they switched to another method. The likelihood that they would survive their suicide attempt changes greatly because not all methods are equal in their lethality. So let's take a look at this. Sorry, people are still coming in. So let's take a look at ambivalence a little bit. This is Kevin Berthia, the young man standing on the Golden Gate Bridge. And this California Highway Patrol officer is Kevin Briggs. Officer Kevin Briggs and Kevin Berthia met on a very sad day, very dark day for Kevin Berthia in March of 2005. Kevin said that when he was thinking of ending his life, he parked his car and he walked towards the bridge. And as he jumped over the railings, he heard someone say, "Hey, wait a minute. I was convinced I was going to end my life, but at the last moment, his voice, meaning Kevin Briggs's voice, made me stop and grab the railings." That's what you see in this picture, me standing on the ledge. I now know that was Officer Briggs. He snapped me back to reality. I was on that ledge for 92 minutes, and for 89 of those minutes, I just talked. I got everything out, and he listened without judging me. Many people who survive highly lethal attempts say something like this: I instantly realized that everything in my life that I thought was unfixable was totally fixable, except for what I had just done. Research shows that more people begin to make an attempt and stop than follow through with an attempt, especially if there is someone who is there who can intervene and mitigate for that lethal method. This is Kevin, the Kevins today. They are prominent suicide prevention advocates and speakers across the United States. And if you ever have the opportunity to hear their story, it's a fantastic message of survival. So thoughts of suicide can be temporary. Oftentimes, people may attempt suicide with a less lethal method and survive, but oftentimes they're never suicidal again, especially if they get the help that they need. So what % of people do you think make a nearly lethal suicide attempt eventually die by suicide? Go ahead and put your answer in the chat box, if you will. Is it 75%, 45%, 25%, 10%? So we have a smidge and a smattering of answers here. The answer, for those of you who said 10%, of those who even attempt suicide, make a nearly lethal suicide attempt, only 10% go on to die by suicide. Now, fortunately, suicide is a relatively rare event, even though it is a significant event. And I don't want to minimize that because it's still 10 out of every 100 who survive a suicide attempt will go on to die by suicide. And that is important that we keep an eye out for those too. But the message here is that there is hope and there is recovery after a suicide attempt. And I'm happy to share with you that I am an example of that. I attempted suicide over 20 years ago and was fortunate to survive and to have found a road to recovery and hope for a happy and healthy life. The next thing we want to talk about is some urgency. Time between suicide as an option and an attempt can be very, very brief. Among survivors of near fatal suicides, when they were asked about the length of time from their decision to complete suicide and to actually make the attempt, 47% said it was less than an hour. 24% said it was less than 5 minutes. Less than 5 minutes from the time between they saw suicide as an option to actually acting on the attempt. So the importance here is that thinking forward, thinking in advance of crisis, that when we recognize someone might be at risk or might be going through a hard time, we need to recommend that there be some time and distance between that person and any lethal means in order to save their life. Now, as I mentioned earlier, not all suicide methods are equal in their lethality. Males are more likely than females to use a firearm. Females are more likely than males to overdose or to use suffocation. So I'm guessing I'm going to have a lot of correct answers on this question. But what do you suppose is the leading method or means for suicide in the United States? Go ahead and type that in the chat box. Is poisoning the leading method? Suffocation? Firearms? This is great. I'm seeing firearms. You guys are smart. You guys have been through lots of trainings. Thank goodness. Yeah. Firearms are the leading means of suicide in the United States and in Wyoming. Nationally in the United States, this slide is saying that 50% of suicide deaths are with a firearm. I think that this slide actually might be for Missouri, because the United States is just at about 50%. And then in Wyoming, you all are higher than that. It's 70% of suicides are with a firearm. Okay. So again, in talking about lethality varies greatly by method. 80 to 90% of attempted suicide with a firearm is lethal. Only 9% to 17% are non-fatal. And if you do happen to survive your suicide attempt with a firearm, the likelihood is that you're going to live with lifelong debilitating injuries. Not always, but oftentimes. Compare that to overdose. Only 1% to 2% of suicide attempts by overdose are actually lethal. You kind of have to be chemistry savvy to get the right amount, the right concoction, if you will, of pills and alcohol, the combination of pills and alcohol in order for an overdose to actually be successfully lethal. 98% of those who attempt suicide by overdose don't die from their attempt. They will end up with injury. They will end up with harm to their body, but the chances are less that they will actually die in that attempt. So why do we focus on firearms? And this is a criticism I hear a lot when I give presentations is, why do you harp on firearms? Why is there such a strong focus, Katie, on firearms? Well, the fact of the matter is the frequency of use of firearms. They're used in more than 50% of the suicide deaths in the United States, nearly 70% of suicide deaths in Wyoming. Compare that to only 17% of suicide deaths by suffocation and 13% of suicide deaths by poison in Wyoming. They're almost always lethal. The firearm lethality rate is 80 to 90%, as I mentioned before. The decision time, as we saw in the previous slide, 25% of people who survived their suicide attempt said they acted on it and they engaged in the suicide act in less than 5 minutes. 75% said it was less than an hour. So the decision time, how fast it can happen, is important to focus on firearms. The availability of firearms is also a reason to focus on firearms. Wyoming has the highest number of registered guns per capita of any state in the United States. I did some research for Wyoming gun ownership, and it said that 50 to 60% of homes in Wyoming have a firearm. Now, being from Campbell County, my guess is going to be that 50 to 60% of gun ownership is actually a lot higher than that. In fact, at one point in time, I saw a news story that put it at closer to 80%. But I couldn't replicate that story or that study to use that factor. So, but we also own a lot of guns. Wyoming residents own a lot of firearms. For every 1,000 residents in Wyoming, there are 229 guns. That's over 132,000, almost 133,000 registered firearms in a state with a population of less than 570,000 people. Natrona County has the 4th highest percentage of residents that keep firearms in their home, the 4th highest in the entire nation, not just Wyoming, the nation. And Laramie County has the 12th highest percentage in the nation. No other county in any state in this survey ranked in the top 100 counties twice. No other state had 2 counties rank in the top 100. Only Wyoming did. So statistics about gun ownership across the US, they're really kind of hard to nail down. So that 130,000 or so firearms, is really could quite be low. If you know some of my friends from Campbell County, you know that they've got more than their fair share of firearms. So it's really hard to nail that down and know the exact number, and it's just the best guess based on registered firearms. Also in Wyoming, it's culturally acceptable to have a firearm. Firearms are part of the cowboy way. It's a required tool that's used for ranching. We use it for hunting, we see it as a sport. And it's part of our identity and who we are as a culture, as a group of people. And so it's another reason why we need to focus on it in Wyoming. Firearm availability is a suicide risk factor. Suicide rates vary with firearm ownership. Simply having a firearm in the home increases everyone's risk for dying in a suicide attempt. Now, don't hear me wrong. Guns do not make people suicidal, but guns make suicidal people more likely to die. 82% of youth who die by suicide use a firearm that's owned by a family member, and it's usually their parent, and sometimes it's their own firearm. Parents often underestimate the likelihood that their child could obtain their firearms. I don't know about any of you guys, but anything that was hidden in my mom and dad's house, I knew because I was a snoop. I went looking. In fact, every Christmas, I knew what I was getting for Christmas that year. Because I knew where it was kept. I knew where it was stashed. So as parents, we can't assume that our kids won't know how to access our guns. So maybe it's not the gun. Are people who live in homes with guns more likely to have mental health problems? Are they more likely to seriously consider suicide? Are they more likely to attempt suicide? The answer to all of these is no. Gun owners aren't more likely to be suicidal. They're just more likely to die if they happen to make an attempt. So who can benefit from CALM? Anyone expressing suicidal thoughts? Someone who only has a vague suicide plan? Only someone with a specific suicide plan? Or anyone struggling with depression, substance misuse, or living with additional potential stressors? What do you suppose? What do you think? The answer is all of these people can benefit from CALM, because we can't determine, what is vague about a suicide plan. We can't know that thoughts of suicide are about hopelessness, despair, and feelings of being a burden We don't know when those feelings are going to get to be too big and too much to carry. We don't know based on the specificity of someone's suicide plan, how quickly they can access the method or the means for which they plan or they intend to bring about their death. So everyone can benefit from calm. When do we use calm? Well, we use it when we just have that gut feeling, when we're seeing all of the warning signs and the risk factors for suicide, when the hair on the back of our neck stands up and we're like, ooh, I think what she's saying, I think what he's talking about might be about suicide. So we can use this even when we're not sure. Again, just kind of some of those quick reminders of what those warning signs are for suicide and the changes that we can see from what is normal, what is expected, and what is now different, what's now presenting. When should we use calm? Use it as soon as possible. It could be the difference between life and death. And you want to use calm whenever there is a concern for that person's safety, because they may be dancing with those thoughts about suicide. And then where do we use calm? We use it where it's convenient, where it's familiar, where it's a comfortable setting, and where it's safe for that person who's at risk for suicide to have that conversation with you. The focus is to keep people alive. So how do we have this conversation? You might be thinking, okay, Katie, you keep talking about this conversation. How do I do this? Start off by just being yourself, being that concerned friend or family member, and reflecting to them, because I see XYZ, I'm worried about you. And when someone is going through what you're describing or what I know that you're experiencing, it's not uncommon for them to think about suicide. And I'm wondering, are you thinking about suicide? So I want you all to, if you're with someone in a room, I want you to take the opportunity to turn to them and ask the question, are you having thoughts of suicide? It's important that we practice asking this so that if we ever feel this way, or if someone that we love ever feels this way, that we don't get stuck with the question in our throat, that we've had some experience asking about it, because it's not a natural thing to ask. So if you're with someone in the room, I want you to turn to them and ask, are you having thoughts of suicide? If you're the person that's responding, I want you to say no. And then I want you to switch roles. We're going to take just quick 10 seconds to do this, and then we're going to move on. Okay, if you were alone by yourself and didn't have a partner to ask this question to, I encourage you to practice this with someone later on tonight, maybe with your partner or your loved one or a friend, so that you get to practice what it feels like to asking the question, expressing concern for their safety, and then asking them directly about suicide. So what do we do if that person, even though we know what we're seeing and we know what we're hearing, and we have that sense, and that person says no, respond to them in a caring and compassionate way. Express your thankfulness for having the conversation with them. Encourage safety. Offer others as a source, offer yourself or others as a source of support, of someone that they can come to if things should change. But then we also want you to identify gun ownership to them as being a possible elevated risk if things should happen. So what would this next continuation of the conversation be? We've said, I see you're going through XYZ. I'm concerned about you, because when people are going through what you're going through and saying the things that you're saying, they're oftentimes at risk for suicide. And I'm wondering if you're thinking about suicide. They say no, say, okay. But if you ever were, I want you to know I care about you, and I want you to be safe. Or you could say, you know, that's really good to hear. I'm really glad to hear that you're not thinking about suicide. With guns in your home, I'm worried about you because guns are a particularly lethal method for people to end their life. And if things should change, I would want to offer a resource of support to you. Or you could say to them, it's good to hear that. I know you've got guns in your home, but I wonder if you know that guns can increase risk for suicide in a moment of despair. So I want you to practice, take this opportunity to practice again with someone that's in the room with you. You're gonna turn to them and say, are you having thoughts of suicide? If you're the partner that is responding, I want you to reply yes. And then I want you to switch roles. We're gonna take 10 quick seconds to try this out. Pay attention to what it feels like inside of you, knowing that the answer is gonna be yes. So go ahead and do that. Okay. If we were in a room together, I would try to debrief this and ask how that felt to ask the question out loud, or how to have responded to that question in the affirmative. My guess is that some of you felt you were confident in asking that question because it's not the first time you've had to ask it. But I'm gonna guess that there's some of you who are really anxious and uncomfortable and uncertain about asking the question. It's okay, however you felt, that's honest and that's real. The important thing is that you had the courage to actually ask the question about having thoughts about suicide. So what do we do in the event someone says yes? You can respond with, thank you for trusting me with that. Thank you for telling me. You must feel really stuck without any options. I'm really worried about you. Can you tell me more about what's happening? And you could also say, I'm sorry you feel that way, and I'm glad that you shared it with me. So then what do you say next? Well, express your concern for their safety. How can I help you? What do you need in order to keep you safe? What can we do to keep you safer? Ask them and explore their access to lethal means, all lethal means, whether it's pills or firearms or belts or heights. Ask the question by saying, well, is there any way or is there a method you've thought about killing yourself? That way you can figure out if they've identified those lethal means. And then follow up by asking them, well, do you have access to how you plan to end your life? Or what would be your plan for acquiring that method to end your life? And then we want you to tell them about, inform them about the importance of keeping distance, putting time and distance between them or the person at risk for suicide and all lethal means. So ask them, what can we do to put some space between you and firearms, between you and the pills? Some other questions to ask, how long would it take for you to access a gun? In Wyoming, guns, shotguns in particular, and rifles can be a tool of ranching, and they're quite easily accessible. And so it may not be uncommon for someone to say, well, there's a shotgun right at my grandpa's back door, or my parents keep guns. I'm of the generation in Campbell County when, it wasn't uncommon for guys to come to school with a gun on the gun rack in the back of the truck. So ask them, how long would it take for you to access a gun? This helps to establish the potential timeline and helps you to determine the immediacy of their risk. Ask them what changes could reduce your access to them. Shift them towards thinking towards safety. Would you consider temporarily removing guns from the home? That's not always possible in every household. So would you consider layering safety measures or installing some safe storage options or removing ammunition from the home to keep people safe from attempting suicide? And then you can also ask them about, are there other people, is there someone else that you would feel comfortable talking to or exploring some of these options with? Or is there someone that you would be comfortable having to hold onto your guns for you until things get better? To keep the conversation going, work together with others to find a plan to keep them as safe as possible. Don't leave them alone until you trust that they can be safe. I want to show you an example of what this conversation might look like and sound like from this perspective of just two gun owners and a brother-in-law. So let's kind of take a quick look at this.
Suicide is a devastating event for any family to go through, regardless of the method used. So reducing suicide deaths is worth the undertaking. And if, as gun owners, we can reduce firearm suicides, then all the better. The majority of gun deaths in the U.S. are suicides, not criminal violence. As people who care about guns and gun rights, we can help bring those numbers down. How can lawful and responsible gun owners help? How can we make a difference?
Well, that was fun, yeah? Did you like the 686?
Oh, I loved it.
Cool, cool.
When's the last time you spoke to your brother?
Yesterday. We were talking about planning Mom and Dad's anniversary party.
How did he sound?
Okay. A little down, but it's hard to tell.
Let's see if we can take him out to supper. Get him out of the house.
Yeah.
I'm really worried about him.
Hey, Bob, Mary, you guys didn't have to stop by. Come on in.
How are you holding up?
She came by today when I was out to pick up some things, and she took Samson. Can you believe it? My dog? She took my dog.
Are you kidding me? You had Samson before you even met.
I know.
We were just about to go get a bite to eat. Why don't you join us? It would be good to get you out of here.
Yeah, let's get you out of the house for a while, man.
No, I just want to stay here, okay? Look, guys, I appreciate you coming, but I'm fine, really. Just go to dinner. I'm all set. I'm fine.
We have some time before we go, so maybe we just stay a while. Give you a chance to change your mind.
Recognizing someone may be at risk is the first step towards helping to prevent a potential tragedy. Putting time and distance between a suicidal person and a firearm just might save a life.
Hey, Stuart, so we were thinking of getting Mary in 1911 in 9mm, and she really liked your Colt when we went shooting last summer. Do you think we can borrow your Colt? Just for about a week, just so we can take it out to the range and see if it's what she likes. You still have it, right?
Yeah, I do.
Listen. We're worried about you. Do it for our sake. At least until the worst of this blows over.
Suicide deaths are terrible for everyone involved. Firearm suicides also hurt the cause of liberty when the numbers are used to justify more gun laws. Let's work together to reduce all suicides, especially the ones where a firearm may be used. Sometimes getting involved at a critical point during someone's despair may make the difference. You may think that a suicidal person without a gun will just find another way to die, but virtually anything they might substitute is less likely to kill them because guns are so quick and so effective. Other people may delay their attempt because suicidal feelings often come and go. The more time and distance you can put between a suicidal person and a gun, the better their odds of making it through alive. Who is best suited to address this issue? The government or responsible firearm owners? Who has the best chance of actually saving lives? Simple steps by friends and family that show you care sometimes save a life. For help and information 24/7, call the Suicide Prevention Lifeline at 800-273-TALK. That's 800-273-TALK.
Okay. So not the most perfect use of or example of the how to have the conversation, but it shows that anyone can have that conversation, no matter what your approach is, from a place of care and concern. So other things to keep in mind is to ask and encourage safety. Identify people who can help. Explore that person's concerns or roadblocks to temporary removal of the firearm. If the firearms absolutely cannot be removed from the home, what are some things that can be done to increase safety? Can they be stored more safely? Can all of the ammunition be removed from the home? Make a specific plan for follow-up. Agree that in order to keep your loved one safe, we need to follow through with whatever plan you come up with to secure the lethal means. Now, some options for temporarily moving a gun from the home. The best and safest option is that temporary offsite storage. So, and oftentimes gun owners are far more likely to be comfortable with a friend or a relative who is legally able to possess a firearm to hold on to them for them. They don't want law enforcement taking their guns. They don't want a court of law intervening. And so if it can be done or facilitated in a voluntary way, that's usually the best option. Sometimes you need to find a storage unit or a place to store them off-site, either through gun shops or shooting ranges. They may offer gun lockers or gun safes to store guns. Sometimes pawn shops. You can take firearms to a pawn shop that is a federal firearms licensee and consign it or take out a loan against the firearm. If you need to be creative, they have to legally register those firearms into their logbooks, and they have to secure them safely so it protects them from being stolen. Some law enforcement agencies might be able to store or hold on to firearms for someone who's at risk. You really need to explore with your law enforcement department if they will provide that service. Some will. Some won't. So it really just kind of depends on your agencies in your community. Explore those temporary other options like load all guns in a gun safe or gun box, remove the ammunition, and then change the combination or remove the key on the gun safe so that the person at risk for suicide can't access it. Sometimes using trigger locks or cable locks are a deterrent. They are not fail-safe. They can be bypassed, but it can also increase the time in which someone could use that firearm in a suicide attempt. I'm going to send out the slides from this PowerPoint so you can also take a look at some of these other slides because I'm recognizing that I'm quickly running out of time. But there's some tips for those who need to have a firearm for self-defense or to protect personal property. Some more guidance on how to shift the person towards thinking to safety. And just remember, putting time and distance between a suicidal person and any lethal means may save a life. So your willingness and your courage to have this conversation with someone who is at risk for suicide is so important. And I'm so grateful that you all participated in this training today.